Our aim is really to inform policy and practice through our findings and not just to produce findings for their own sake. But we do recognize that this can be a slow and complex process. So now we've just finished the first phase of our project, which was to produce a report and to gather this information and have a landscape analysis of health purchasing in the region. And the next stage will be really to use the information that we've gathered for more consulting activities, capacity building, trainings, policy advocacy, and engagement. However, we did find that it wasn't really about gathering the information first and then advocating for strategic purchasing and health system strengthening. The two actually went hand in hand throughout the process. Because as we were carrying out our research, when we conducted stakeholder interviews with senior members of the MOH or focus group discussions where we brought stakeholders together from different parts of the health system, we found that even having those conversations kind of flagged up the topic of strategic purchasing where it may not have been flagged up before. And it informed some of these decision makers and some of these stakeholders about what the concept is and the fact that there's now a network working on strategic purchasing on a regional level, which is something that hadn't existed before. So really, I think the main thing that we've achieved so far is to kind of try to flag strategic purchasing as a viable financing tool that exists for health systems, and also to flag up that having a regional perspective on this could be very useful, and that countries don't only have to work in silos and just have development partners come in and help them setting up strategic purchasing systems, but countries in the region can actually learn from each other. Even where health systems are very diverse, there's still some lessons that can be applied, and some experts who may be willing to fly out from, say, Thailand to the Philippines and give a workshop on something, and it's an opportunity that ASEAN can try to take up, because often there is a very, very strong collaboration on health systems in the region, and that's something that we're trying to build up slowly, and we've started doing, and hopefully we'll be able to do more of that over the next few years. So actually in our report we did produce some policy recommendations. So we had some national level recommendations for each country, and then we had common recommendations for the ASEAN region, and these really involved recommendations on how to have strong data collection mechanisms for the region as a whole, for data that might be relevant to measuring the level of strategic purchasing going on in each health system. Another main recommendation we had was to actually use existing venues within ASEAN to have these cross-country conversations on strategic purchasing. So whether a regional coordination mechanism or use avenues such as regional conferences or ASEAN meetings on health to bring up these conversations and enable cross-country learning. But of course, it's very early days, and for now, we've just recommended this, and hopefully it will be more and more accepted in the future. One of the first things that we're going to do, which the SPARC framework will be quite useful for actually, is we're planning some capacity building sessions in the next few years. So these will be workshops, maybe rotating across different countries in ASEAN, and we'll teach maybe mid-level managers in the MOH or in the national health insurance bodies about what strategic purchasing is and what it involves and the core functions that are necessary to make a health purchasing system more strategic. And hopefully this younger generation can in the future raise capacity for strategic purchasing in a health system as they grow, more influential within their ranks and progress in their careers.